Welcome to the August edition of Boston Children's Hospital's Answers for Families. We're so thrilled that we're live on YouTube and Facebook, but don't worry, if you've got friends or family who want to see this edition again, we're going to be archived on our YouTube channel for Boston Children's Hospital. But today we're talking about back to school. We've gotten lots of questions from families, and I'm so happy we're here. We're going to have a really good conversation. We are here with Rosenberg, and we're here with Jen Aites. And you guys work in partnership with ASK. It's Advocating Success for Kids. Maybe talk about that. You're a licensed clinical social worker and you're the medical director?
Yes.
So talk about ASK and how it partners with the Boston Public Schools and primary care patients.
Yeah, so ASK stands for Advocating Success for Kids. So we are essentially a developmental pediatrics group pushed into the primary care center to help kids with neurodiversity, with learning challenges, be able to access school and various services that they need at school and in the community.
Wow. And it must be great to see these children thrive, coming from challenging backgrounds, or at least some of their situations, and to set them up to succeed and to advocate for their success. So that's great. Yeah. Well, we're talking about back to school, and I know a lot of parents are happy that it's back to school time, but a lot of kids are very nervous and anxious. So let's just break it down. How can a parent help a kid really succeed that first day, that first week? And it sounds like we should back it up, and maybe a couple weeks before that first day, start preparing. So let's talk about what can a parent do.
I think it's great to get kids excited for school a few weeks before. We're 3 to 4 weeks out, at least in our area, from the start of school. And thinking about routines, getting kids maybe back into a little bit, if they haven't been in many routines in the summer, thinking about what do you want the routine to look like once school starts, what should bedtime look like. Thinking about orienting the child to the school if they're going to a new school for the first time. Can you check out the playground?
Practical things. A lot of kids over the summer are out of their routine for school, maybe going to bed a little bit later, waking up a little bit later. So getting them, backing bedtime up slowly across the weeks. We usually say by 15 minutes every week.
So it's not drastic.
Correct.
That's very good.
Yeah. And the amount of sleep a child needs is dependent upon their age as well as each individual child. So thinking about how early do we need to go to bed so they're not tired in the morning when you need to wake them up for school. As Ali mentioned, doing for kids who are new to school, but also kids who may be a little nervous about going back to school, going to visit the school, playing on the playground.
I love that idea, going to the playground.
Yeah.
Because you could do that anytime.
Yep.
And just, check it out. But I guess you would need permission and they may let you come in and walk the halls or visit the classroom, but that would be case by case.
Yeah, it'd be a good idea to reach out to the principal or another school personnel who's working over the summer if your child has some special needs or some mental health concerns, if they might want to check out the classroom before school starts or even meet the teacher. It's always good to reach out and be proactive and see if that's a possibility for your child.
Yeah.
Also to start talking about school and getting excited for school of who is the new teacher. Thinking about if your child packs lunch, of what kind of things do they want to include in their lunch or what kind of snacks they may want to have. Thinking about some of the logistical supplies for school with backpacks, school supplies, clothing. We're coming into the fall, it's going to start getting cooler again and kids have grown, so getting kids involved in thinking about some of that stuff as well.
Yeah, and families don't need to go on a big shopping spree to get everything new, right? There are lots of opportunities and resources for discounted good supplies or free supplies.
Yeah, and I would advise talking to your pediatrician's office or other nonprofits in your community if it's financially difficult for you to get school supplies, or if your children have outgrown clothes from the last school year. There are a lot of resources to help families.
Yeah, I'm old, but I remember that Trapper Keeper. Oh, I got my new Trapper Keeper.
Yep.
Yes.
So speaking of the pediatrician, let's talk about the physical. And so a lot can happen in a year, you know, from what goes into the physical, should you prepare your child for that physical, and then, you know, why is that so important for both the parents and for the school?
I think from the medical perspective, we recommend a yearly physical.
Yeah.
So coming in every year to see how your child is growing, getting a checkup from head to toe to make sure that they're developing as they should be developing and that they're healthy. From a school perspective, anytime you're entering a new school, or either the first time or switching into a new school, you're usually required to submit a copy of physical and immunizations.
Yep.
And then every, I believe it's 3 to 4 years, you're required to provide an update to your school.
And if kids are playing sports, they are required to have a physical every
Right.
year.
And is that separate? I think that might get confusing if my kid's on a sports team. Is that a separate physical, or it can all be covered?
Same thing.
Okay.
Same thing.
Good to
Yeah.
know.
Can be used for sports, school, and camp.
Yep.
School and camp, okay. And then, you know, I guess hearing, vision, you know, there are lots of things that can change in a year.
Absolutely.
Yeah.
And hearing and vision are usually screened at the pediatrician's office. Those, once school is back in session, schools are sometimes doing screenings as well.
That's right.
Yeah.
That's right. And then I guess you know, so the screening or the physical, let's say a child needs medication, and then that must be stressful to know for the child to have to get that med from the school office or nurse. How do you prepare a child for your inhaler, or you're going to need some medication every day? Is that it seems like that would be stressful too.
It can be. I
Yeah.
think it's about preparing kids, but also preparing the school and making sure if your child does have a special health care need, that you're communicating with your school nurse before the start of school. Many schools require written not many, all schools require written documentation regarding the healthcare need and the medication and a medication administration form, as well as a prescription that they can keep at the school.
Right.
I know from personal experience, we drop off our children's medication before school starts, and
Yes.
the nurse has parents sign up to drop any medication off before school. So it's taken care of before school even opens, and usually on your school district's website there are forms if a child's going to need to take medication during the school day that parents can sign and have their pediatrician sign as well.
Yeah, that's a good point. First day must be so crazy for a school, and to deal with medication on that first day, you know, what a nice way to avoid that is just going early. That's great.
Yeah.
So should we talk about IEPs? Because I know lots of kids are on IEPs, and what goes into those, and then how can a parent really advocate, we're talking about advocating to make sure that IEP is well known in the school among all the teachers, and is followed and championed.
I think it's a good idea for parents to check in with their child's classroom teacher every year to make sure if the child is on a 504 plan for classroom accommodations or on an IEP, that the teacher has a copy, that they've reviewed it. And if the parent has any questions or concerns at the start of the school year, it's a good idea to reach out and express those. I think if your child is not on an IEP, but there are academic, attention, mental health concerns, it's a good idea to talk to your pediatrician to see what they recommend.
And just to back up, just for some people who may not know, an IEP stands for an individualized education program, and it is that public schools are required to provide students with equal opportunity to access the general education curriculum. And if they're not able to access it, or they're having difficulty accessing it, parents and families can request an IEP evaluation through their school and talk with the school teachers and the school team about what the concerns are.
Right.
And in Massachusetts, parents can put that request in writing at any time, and then the school has 45 school days to complete that evaluation once the parent has signed consent, the school's consent form. But again, communication, I think, is key with the school. I think they, as well as the pediatrician's office, can help guide parents to appropriately determine what's going on with my child? Do they meet criteria for a diagnosis, a disability, and what services do they need?
And then 45 days, it sounds like, I mean, that's an opportunity for lots of collaboration, the teamwork between medical, the teacher, and the parent. And really, I guess the parent is kind of trying to advocate for their child. I guess there'll be challenges with that. And with the stress of the new year, and for this child who's so nervous. Mm-hmm. Any advice to how do you lower the temperature, or how do you keep everyone not so stressed? I don't know. Or is it possible?
Well, I think communication is really important. Yeah. So having a lot of communication and open dialogue with both the school as well as use your pediatrician's office. We're specific to Boston Children's Hospital, but a lot of pediatricians' offices, pediatricians themselves or social workers or other support people in your pediatrician's office may be able to help give you some advice and guide you.
And many schools have school adjustment counselors or school social workers who I think are available to lower the temperature, and support kids who are struggling, support parents who are trying to navigate these complex systems, and be a person who can bring everybody together on the same page. Right. The school, the pediatrician's office, the parent. I think you can utilize a school counselor or a social worker at the pediatrician's office to bring everybody to the table.
Wow. So new year, new kid, new in school. How do you then, maybe a teacher is saying, hey, I'm observing some challenges, or I'm observing some delays, or there's a situation going on, and this could be in the first couple weeks, I guess, right? If it's a new teacher, how does the pediatrician, or how would medical staff get involved with kind of a game time assessment in terms of, hey, this is something we should look at?
But I think talking with the teacher about the concerns, learning what the concerns are from the school, and then bringing that to the pediatrician. What have they told me? What have they told our family about what's going on? I also think we do a lot of collaboration with schools too, where if parents are consenting, we can have a conversation with the family, with the school as well, to see what the concerns are and what the next best steps are.
Certainly we want kids to be able to adjust to the next grade, and give kids a little bit of time. But if this has been an ongoing issue from the year before, or even 2 years before, we don't want to let things go. We want to really make sure to intervene early so kids can be as successful as they can be with the right supports.
Right.
Yeah, and I think that it's important thinking of every year is a new transition, and that can be rocky for a lot of kids, and doesn't mean we need to jump on things because the first week was really hard. It may be let's wait a few weeks and see how everything settles in.
Right. And I guess patience maybe would be some other advice for, it's not all going to be solved. Everything's not going to click that first week. It's going to take time to kind of work out all the bugs.
Yeah. I think that's particularly true in kindergarten or any major transition year.
Right. I think of kindergartners and I think of snacks, what advice on, how do you deal with, or should a parent approach snacks, and what that child should bring in their backpack every day?
We've talked about how we want kids to eat healthy snacks as much as possible, but we also want kids to eat. And I think involving the child in the packing of the snack process, depending on their age, can be really helpful. So you know that, okay, they picked it, they'll probably eat it. Giving them choices, here are 3 things you can bring. You get 2 of them, which 2 do you want? I think can be helpful.
Give them a little control.
Yes.
That's great.
And it's generally the school snacks or any food you're bringing into school is usually not a time to push something on a child that they're not regularly eating.
Right.
It's important, we want to keep kids fueled during their school day. It's a long day, so it's important that they're eating and not trying new things.
Yeah, personal experience, I remember opening the backpack at the end of the day. It's like, no one touched the carrots. Right? Like, it was such a good idea, but,
When you want to include those healthy options, but if you know your child never eats carrots.
Why start,
yes.
Right.
during a very stressful week?
Yes.
Yeah.
Right.
Yeah, that makes sense. And then I'm sure ask about the policy, you know, of what type of snack, or maybe the school will have snacks, or what, you don't want your kid to stick out with
Right.
a certain type of food.
Most schools have nut-free snacks, so it's
Right.
important to know, due to allergies, what kids are allowed and what they aren't allowed to eat for snack time. For lunch, you didn't ask about lunch, but I'm going to chime right in
Lunch.
with some news about lunch.
Tell us.
That in Massachusetts, moving forward, that lunch will be free for all children. This is recent, in the past few weeks, maybe even just the past week, I'm not sure, but
We call that
exactly.
breaking
But
news.
it's breaking news. So lunch will be free for all students. So parents certainly have the option to pack lunch, but it is now an option for all children in Massachusetts to receive lunch for free,
Right,
which is really exciting.
right.
Yeah.
I liked what you said about, you know, a couple weeks before, maybe start on, you know, these are the snacks you would be eating, and start on this is the lunch you'll be eating, to get them kind of excited, and so it's not all so new that first day,
Yeah.
to really start talking.
Talking about it, what snacks, if some kids don't like school lunches, so you may
Right.
still be sending a lunch in.
Right.
Talking about what might they want in their lunch and what are different options to have at home to
Mhm.
get them involved.
Mhm. We have lots of questions from people who submitted them, but first, what have we not covered? What are things that your parents and families that you help every day? What are you observing that we should really share with our audience here?
I think getting it both before school as well as after school, start thinking about routines and getting into routines. I mentioned a little bit about the bedtime routine, but also thinking about what's happening in your house in the morning. What is your wake up routine? Are you eating breakfast at home or at school? Brushing teeth, getting dressed, start to kind of practice and come up with a timeline in the
Right.
morning for all of those things.
I remember laying clothes out the night before,
Mhm.
right?
Yeah.
Having everything.
And helping your child get involved in picking out their outfits for
Right.
the day. And
Right.
that can usually make your mornings go a little more smoothly if it's
Right.
something they've chosen.
Right, just like the snacks, having that autonomy, I think kids really can feel empowered about their school experience if they have
Right.
some say over snacks, clothes, the color of their backpack,
Right.
if that's a possibility,
Right.
what outfit they're gonna wear the first day.
Right.
And I think just being enthusiastic about school can really give the message to kids that school is an exciting, safe place that, you know, get them off to a good start for the year.
That's fantastic.
And then after school routines too, that's
Right, so
something
you-
that we were
Yes.
talking about. Coming home from school, some kids will have homework, and setting a routine of what the expectation is, maybe coming home, having a snack, taking a little break and then getting started on homework, or whatever works for your family's schedule.
Yeah, I was thinking about after-school programs. So many kids are in after-school programs, and if the program's going to be new to your child, visiting, just like you would visit the school, having kids do homework there, that can be a real time saver for families, and there are usually supportive adults to help kids with homework and after-school programs. Yeah, just making sure kids know sort of what the expectation is after school.
And setting up the kid's room, or maybe the playroom, or some area in the home to be suitable, or to really be comfortable for homework, for that work that
Yeah.
has to happen after school.
Yeah, and if you're doing homework at home, as much as you can, reducing distractions, having kind of a distraction-free environment for kids to sit down and do their work. As much as you can, if you can isolate other siblings who may not have homework,
Right.
so kids aren't, being distracted by siblings that are off doing something else while they're trying to get their homework done.
Yeah.
And giving breaks. As kids get older, there is more homework, it takes more time. Sometimes it can be hard for kids to sit down and sustain their attention for such a long time on the homework after a long day.
Yeah. Very good. Anything else before we jump in?
think having dialogue with your child at the end of the school day, checking in to see how the
Process.
school day went, yeah. And lots of kids, how was your school day? Fine, it was fine, or it was good. Asking questions, is there anyone who made you laugh today?
Is there anyone you helped today?
Anyone you, right, did you make a new friend? What was their name? Asking some more detailed questions can
I
help
love
get
that.
information out of kids.
I love that.
Best and worst part of the day.
Best and worst, yep.
Yeah.
Oh, that's great.
More specific questions get you more answers.
That's great. Well, I want to thank everyone for submitting some great questions that we're just going to run through now. The first, some parents feel that melatonin is a safe drug to be given to children who are having difficulties going to sleep. What are your thoughts? I'm sure this depends on the brand and the dosage and
It
all
does.
that.
I think there are a lot of, it depends. I think, I would recommend talking to your pediatrician about it, of is this a good option for your child? What kind of melatonin would it be? What dose of the melatonin? But then also just generally what's going on. For some kids who are having trouble falling asleep, there may be other things going on. There could be some anxiousness, and something like melatonin isn't going to help with that. There could be, as kids get older, often bedtimes shift later, and so sometimes we're putting kids to bed too early. Their bodies are just not ready to wind down. And so thinking through and troubleshooting some of the more practical things before jumping to something like melatonin.
Mm-hmm. That's great. Any thoughts on that? We covered that. What's
Not
the
doctor.
what's the best way to get back on a sleeping and healthy eating schedule after lots of wonderful summer travel with snacks and late nights? And how do we adjust to early school drop-offs and school days? We covered a little bit about that.
A little bit. That's where I think you want to, even, in Massachusetts, school's starting at the end of August or early in September, so we have, 3 to 4 weeks before we're getting back into school. This is a great time to start to slide those bedtimes back.
Mm-hmm.
And usually in 15-minute increments is what we recommend.
Yeah, I love that.
15 minutes every week.
Mm-hmm.
And then talking with the kids about what, as we're on a stricter sleeping schedule, what is our routine that we need to do before we're going to bed, and having a solid routine to go through that get kids ready to be able to fall asleep at night.
Nice. Here's another question. How does one help a child with school-related anxiety? And I'm sure there's lots of different anxieties, lots of different causes, and at what point do you talk to your pediatrician?
You're right. It depends.
Depends.
It depends.
Yeah.
Is it beginning of school jitters, and that some of these things we've already talked about with going through routines and talking with your kids and getting them excited can help with some of those jitters. Some kids have not just school-related anxiety, but underlying anxiety about more things than just school, in which case any of them is a great opportunity to talk to your pediatrician for some tips. If your child is having a lot of anxiety where it seems to be impacting their functioning,
Yes.
where trouble getting through the day or leading up to school, trouble falling asleep because we're thinking about it a lot, that's definitely something to talk to your pediatrician and see if there are any, behavioral health providers who may be able to provide some guidance and support to your family.
Yeah.
And I think once school starts, also reaching out to the mental health clinicians that work in the school social worker, school psychologist, depends on your school who is available to work with parents. But having that dialogue, I've noticed some anxiety in my child, has the teacher noticed this,
Mm-hmm.
or anyone else at the school, and what tips, tricks, and supports do they provide at school as well?
That's great. That's good. It's scary. So this is also about anxiety. How should I gently address anxiety about transitioning from a small local elementary school to a very large regional school?
So I think some of the things we already talked about with that, doing visits ahead of time if there's an orientation, attending an orientation to let your child see the school, meet
Yes.
some of the new staff, meet some of their new classmates. Some suggestions of if you can connect with anyone ahead of time to have some set up a play date or a get-together with some other schools so kids can become familiar with each other.
Yeah,
It can be helpful to have a friend as you're going into a new school.
right. I like that idea. Anything else to add?
I think the only thing, other thing I would add about that one is maybe to reach out to the parent-teacher organization, to see if they have any kids, your kids' age to connect you to.
Right.
Some schools do a buddy system, so, yeah, just making sure you have all your bases covered in terms of the resources that you can have for your child to make them comfortable as they enter the new school.
That's great. Those are all the questions. I have a question, and this is just my curiosity. So you're the medical director, you're the licensed clinical social worker. How do you guys collaborate with a patient, family, or just in behind the scenes with lots of different families? How does that work at Ask?
We're constantly collaborating.
Yeah.
We were in clinic this morning and in visits together with families.
So sometimes you both will be with the family.
Mhm.
That's great.
Or sometimes if we're not together with the family, it's just chatting with each other after a clinic session.
Yeah.
And then we are able to also get permission from families to be able to contact schools, to be able to talk to different teachers or counselors, or for those who have IEPs or 504s, the special education providers, to kind of all come together to support families and kids.
That's great. Good, well that's wonderful. Well, thank you very much everyone for joining us live, and like I said, we're going to have this archived on the Boston Children's YouTube channel, and I want to thank Rosenberg and Jen Aites. It was just wonderful having both of you here, and how lucky a family to have both of you collaborating and helping this child succeed and really advocating for their success. So thanks again for joining us, and I'm Brian McKeag, and we'll see you later. Thanks again.